Hi, my name is Joe Scanlon. I'm the co-founder of Scanalytics, and I'm showing you here today some unique ways that Scanalytics smart flooring can be used to operate a more intelligent healthcare environment. So I'll start off with this view, which is a patient room monitoring view. So in this first view, I can see all of my patients' rooms color-coded by conditions that I set on urgency. So if I want that to be set on the last time that they had been moving around or the last time they were visited by staff, those are all things that can be adjusted. But in particular, I can click into a specific patient room and get a lot more information on that particular patient and their stay at the hospital. So I can get information like the last time there was a check-in, their last activity. So are they in the room? Are they in the bathroom? Are they in their bed? Where they're currently at. An activity log. So this could be information that's added from nurses and doctors' notes, as well as what's being pulled from the floor sensors on their movements. I can also take a look at this movement density map, which gives me a better understanding of throughout the day and throughout the multiple days, where are they moving, what times of days are they moving the most, and how is that potentially impacting their recovery. I can also take a look at specifically, if it's applicable, I can take a look at things like their activity trends and apply predictions to that. So if I know that this patient is important for them to be moving around throughout the day or not moving around throughout the day, I can take a look at things like their stride length and their step symmetry and walking speed, and that can help me better understand how quickly they are recovering or not. I can also take a look at another view of just generally with this particular patient, what has their staff engagement levels been throughout several hours or across multiple days. And this one's interesting with each one of the computer readout boxes that the smart flooring is powered by. It also includes a measurement tool for noise levels in that room. So it's not recording any audio, it's just recording decibel levels that can be picked up from the floor sensors. So in this particular case, I can see over the last 12 hours through 15-minute increments at what level was the noise in that particular room. Obviously, noise has a big impact on patient recovery as well as patient satisfaction. So it's something that I want to take a look at all the time. And I can see areas that it went above any threshold that I set. So if I set the threshold at 45 decibel, I can take a look at every time that it rose above that. I can even look inside that, what was happening in that room that might have been causing that noise level to rise so that I can mitigate it in the future. So in this particular case, it looks like there were 5 people in the room at that given time. Possible causes of that, of course, visitor activity or patient distress. I can take a look at that and get a better understanding of how to make their experience better. In another view here, I can look at space optimization. So I can, let's say I want to look at the cardiology waiting room. And in this view, I can see specific information about this particular waiting room. So I can see the average wait time, the average occupancy rate, and the peak hours. I can also look at the utilization trends of occupancy over the course of multiple days in one view. So I can start to look at trends. And most interestingly, I can run a prediction model. And the prediction model gives me information about what is expected in the next 7 days, one day at a time, based off of the previous 14 days. So I can look at what staffing and where in the waiting room I might need to mitigate issues like patient buildup or waiting times based off of what's happened in the past. Then I can also take a look at the actual patterns of walking and utilization. So where are people actually starting and ending and where are they spending their time, and how can that help me better design the space so that I can get more efficiency out of the space. In this hygiene compliance view, the floor sensors are reporting the time spent and the number of times in front of key areas like hand washing stations inside of rooms in the ER, ICU, general ward, operating rooms, outpatient, etc. So here I can look at the times that there was visits from the nurse or doctor that was entering that room, the compliance by shift, and I can start to see patterns of whether or not I'm staying in compliance with the hygiene that the hospital has set default standards for. In this facilities management view, I can take a look at, for example, all of the paths that were created throughout my entire facility over the last 24 hours. I can set this to a different time if I wanted to, but this gives me a good understanding of throughout a typical day, where are people spending most time? Where's the density of buildup of traffic, and what can I do to better design workflow and movement and foot traffic flow throughout my facility to get better usage and more value out of my facility. That will also feed into an optimizer for my cleaning schedule. So the floor sensors will report utilization based off of actual usage. So actual foot traffic in areas like waiting rooms or hallways or bathrooms, cafeteria lobbies. This will tell me not just to clean something that hasn't been cleaned on a time schedule. This will actually give me what is priority cleaning based off of what actually got used. This would help me with optimizing my labor and staff that I am deploying to clean these spaces. It'll also help me save on resources like cleaning resources and materials and water. And speaking of cleaning resources and materials, this tool here allows me to look at those spaces, but also predict when I need to reorder or resupply resources like soap or paper towels or toilet paper rolls. And so I can look at the floor sensors are capturing at how many paths or how many visits does it take to consume a certain number of soap. So in this case, 2 liters of soap, for paper towel rolls. And I can click a prediction model that will tell me an actual date based off of today's supplies when I might need to reorder if foot traffic and utilization metrics remain what they are today. So as new data comes in, it gets smarter and better at predicting when you need to reorder, but allows so that there is no lag between supplies in these areas and when they're needed. This view is pretty cool. This is a view of a rehabilitation room. So in this particular case, let's say we covered a few rehab rooms where physical therapy is taking place. I can use the floor sensors in a way that allows me to view the progress on certain patients and their path to recovery. So in this particular case, if I want to take a look at patient 4, who had a hip replacement and was admitted on the 9th of August, I can click here, view progress, and what that'll pull up is initial information on the metrics that underpin their mobility health and the progression of their particular ailment. So in this case, if it's a hip replacement, I care about things like how the stride length is changing, the step symmetry, and the walking speed. And so as I build a physical therapy program for this particular patient, not only can I get their feedback on how they're feeling, I can actually get objective information captured over time about whether or not my program is improving the underlying metrics of health for them. So it'll automatically produce the analysis of that, and I can use that to give better care to a specific individual patient, but then find out what's working for certain types of patients and apply that to future patients for fast recovery, as fast recovery as possible. Another really unique thing about the floor sensors themselves is we can build them in a way that can be sent home with the patient. So let's say this patient we sent home, and we want to understand what they're doing at home so that they can not be readmitted and be healthy staying at home. There's a home monitoring view that would allow for the sensors to be sent basically in mats that they can put in key areas like their bedroom, living room, kitchen, bathroom that they could take from the hospital with them. And then I can get, as the physician, I can get a report on their recovery insights. So I can actually see things like, in this particular case, it's showing increased living room activity that's suggesting improved mobility for this patient, consistent kitchen visits that indicate regular meal prep, stable bathroom usage. So I can take a look at these things even after they've left the hospital for a set period of time, which is a really unique feature that is not really available with other technologies. I can also use the floor sensors for security views. So for example, you'll see here you saw there a traffic buildup in zone E. So you'll see real-time alerts as to behaviors and traffic buildups in spaces throughout the facility that is important to know, so that if I, as the security team, need to deploy any staff or resources to look further into an incident, I know where they should go, I know what's happening, and I can give them more context. I can also look at things like pulling in weather forecasts and local events. And what that does is that'll help me better understand how many people are going to be visiting the facility at that particular time. So if I start to see trends that when there's a local concert, that might be a medium risk because injuries might be increase through that period of time. More people might be coming into the hospital, and I will want to be prepared for that through staffing and resource planning. So this lets me get ahead of that with predictive alerts and modeling for based off of events. I can also connect those to mobile alerts. So any given time that there's an alert here that if I'm not in front of my computer and I'm on the security staff, I might want to get a message that this unauthorized access that happened in Zone C gets sent to my mobile phone so that I can look at that while I'm on and patrolling the facility. This energy management view is a pretty straightforward view of showing how the force sensors are delivering occupancy-based HVAC and airflow control. So this allows for us to help decrease the amount of energy being wasted through operations like HVAC, as well as actually saving on kilowatt hour usage of the facility. So there's a return on usage by better managing HVAC through occupancy versus just a time-based schedule.